You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to.
The first thing to say is that we don't take self-referrals. Referrals to us do need to come from a professional on your behalf, which might be your GP. It may be if you have a social worker or you're seeing a therapist or another professional who's working with you. We're not too particular about who the referral comes from. Ideally, it's someone who knows you well and knows what to put into a referral to query why you might be autistic. We have a service referral form which maps out the kind of information that we need quite clearly. So within that, it asks about obviously your personal contact details, next of kin, any health conditions or diagnoses you may already have, another personal background to give some context to your current situation. And it also asks about your personal characteristics, which might indicate that you have undiagnosed autism. So typically, within the diagnostic criteria, we would be looking for features in the context of differences in how you function socially, with communication and relationships with other people, but also things like whether you have any particular routines or interests, and also any differences in your sensory functioning, which is not just your sight and hearing, it's more about if you're very oversensitive or undersensitive to things in terms of noise, light, if you have particular food habits or food intolerances, if you're very sensitive or undersensitive to different types of touch or feelings of clothing fabrics on your skin. So the referral is trying to get a sense from yourself and from the professional referring you what they think are some of your characteristics or features which might indicate that you're possibly autistic, and you need that diagnosis or assessment to clarify a diagnosis. We like to look at everyone as an individual, so there's no information which is necessarily relevant or not relevant. So that's why the form has these prompts to get information about you as a person. And we like that completed in as much detail as possible, so then we know what we're looking at. The form does also clarify that as an adult that you're agreeing to the referral and that you're aware of it. I mean, that might sound quite obvious, but we do get referrals on people's behalf because someone else is raising the query that they might be autistic, whether that's a family member or the doctor. We're not going to do an assessment with you if you're not agreeing to it or that you don't want it. So the referral form does make clear that it needs to confirm that you're consenting, and that's quite normal practice for any clinical service. So as I said, we don't accept self-referrals from people to access our service directly, but we do know that a lot of people have done their own research or are raising the question themselves that they might be autistic for some reason, and we know that the reasons for that can vary a lot. So what you can do, and I would recommend, is if you are then going to go to your GP and ask to be referred to us, make some of your own notes and take them along to an appointment. And you can always ask your GP to send that information of yours along with a referral, and we can look at that with whatever the GP or other professional sends us. It can be really helpful to have your own take on why you think you might be autistic.